Hi, I'm Pat Bollom, the co-CEO of Smart Data Solutions, and good morning. On Pat's couch today, I'm solo. Normally I'm on the couch over there, but I'm going to be here with the screen going through and talking about the coronavirus. People have been asking us, how has the coronavirus and COVID affected Smart Data, affected us? And I wanted to go through, again, I believe it's mainly my clients, customers, partners who are working, looking at this. And I want to show you, here's some of the effects we've seen from coronavirus. I'll keep it short as always. Try to keep it to under 6 or 7 minutes. It was an insane 2020, and based on the last 2 days at the Capitol, I'm assuming 2021 is going to be a wild ride as well. And for me to talk about coronavirus and COVID and how it's affected us, I want to take a look back at some of the stats on where we're at with the virus. I don't believe I'm plagiarizing anything here because I'm showing you the websites that I'm getting it from. Also, I don't want you to think I'm Pollyannish about the virus. I myself have had it. It had minimal impact on me. That said, I don't want to minimize somebody else's experience, and my heart goes out to those who've experienced loss due to coronavirus. So as far as the first website, I don't know how many of you go to the CDC's website to look at the stats, but if you look at all deaths involved in COVID-19, on January 4th, obviously, it was just arriving from what we know. And then it increased, and when you get to end of April and May, you're seeing higher death counts. Went down during the summer, obviously, and has gone back up as the cold weather's come on. The CDC's numbers show a lag, but actually those decreases are not true. It's based on the news and the new strain and the social distancing that's been relaxed. There's actually an increase going on. As far as going to the website, and information is beautiful. COVID-19 stats, this is a great website if you haven't been to it. Information is beautiful. But the interesting thing about this one that I wanted you to see is, although our cases are going up considerably, right here is the US, you're seeing the deaths per million staying right in the middle of the pack. So that's a good thing. The other thing that's really important to look at on this site is the impact of pre-existing conditions on the chances of your dying from the disease. Obviously, if you have no pre-existing conditions, your chances are slim to none. Your prognosis is pretty good should you get the virus. If you have 3 pre-existing conditions, things are not so rosy. So just good information to take a peek at. As far as the new strain of the virus, they're saying right now, when you look at what Michael Osterholm from the University of Minnesota has to say about it, it looks as though it's about 56% more transferable, more contagious, but as far as lethal, those numbers aren't really showing an increase yet, but it's new enough that it's something we want to monitor each day. As far as this article on the usage of healthcare, this is a great article on where healthcare is being used and where it's going. So this is year over year spend. Q2 of 2020, you're seeing that spend down considerably. When you look at the spending on services in general, down considerably. Again, nothing that you didn't expect. As far as where is the spend up, it's on labs, obviously, for testing, and it's in nursing homes. When you get into observed admissions, obviously there's that dip in April, May, June. Telemedicine numbers up considerably. This is great to see. Not sure if you're using telemedicine. My family is, and it's been super for us. As far as coming down here, here's the one where we all want to clap and cheer. Distribution of individual market insurers by the change in their 2021 premiums. That's 0, my friends. The insurance companies are definitely stepping up their game, so that's great to see. As far as expectations for the virus in the future, here are all these experts and what their predictions are. Predictions completely all over the board. Not sure if that's affiliated to their, which party they support or what that may be, what research they've done, but it's all over the board. They took it in aggregate and the trend is still down. So that is somewhat promising. As far as this particular graph I wanted to show you this was a bunch of European CEOs on where they saw healthcare going. Again, the important thing that you're going to see here is that rise in telemedicine, growth in online pharmacy channels, but also you're seeing that 86% increase in the pharma supply chain reconfiguration due to the vaccination being rolled out. But again, still seeing a lag in the dental appointments, the psych appointments, the chiro, physical therapy. People are not going back. As far as the COVID vaccine rollout, getting to the end of my charts before we get into smart data information, The rollout plan, is again to start with healthcare workers in long-term care facilities. We started out with 2.9 million doses being shipped on December 14th. That was 3 weeks ago. And then after that, it'll be based on medical condition and need, and those in need will get the vaccine first. As far as smart data, which you want to get into, where are we at? Here's our EDI volumes since January of 2020. Again, the graph, we had just started tracking it this way because we changed the way we're tracking it. So you're seeing some irregularities here, but you're seeing it was up, then it dipped down, and now it's come back with a rage. Again, the holidays present us some discounted numbers, but paper volumes, same thing, have come back with a vengeance. We saw the big dip. This is a 2-year. So here's where the virus is, and everything is climbing back up. As far as SOWs go, statements of work for us and the work our clients are doing, you saw that immediate increase beginning of year, like it always is before summer vacation hits, where people are scoping projects and want to know more about them. So you saw our increases, but our execution of those SOWs has definitely gone up, even in light of the fact that October, November, we stopped taking new SOWs. I shouldn't say stop taking, but they're put off and we can't guarantee a 1/1 go live date. So other considerations from the virus for us is our work from home has definitely increased. We've embraced it now, and we track people based on a few things. First of all, based on the systems. We have software loaded on their system where we can check what their usage is. And then our management by objectives, which is the most popular. And lastly, we just track activity in general. We worry about training for the new people and maximizing people's contribution. And so that's really important that we have them in. Yesterday, we had another meeting on site of all the new people so they could familiarize themselves with the systems with the others in their group. And then culture, as you know, John and I we really value having a good culture, and culture has suffered. We're unable to have the gatherings and the parties. But as soon as this is over, we're going to come back with a vengeance. So it's going to be good. Our customers are looking for additional efficiency. They're looking for automation. They're looking for disaster recovery. And that's what we're offering them. After we put the plan together on how we were going to approach the virus based on various scenarios back in mid-March, beginning of March, we said, let's attack automation. And we have gone insane with automation. The graphs I can show you if you want to talk on just so many different automation projects. That team has grown considerably. Anywhere we can save money is where we're going after. And this has led to a bunch of these SOWs. So if you want to talk about projects to introduce more efficiency, more transparency, more manageability into your incoming volumes, let me know. Long-term effects, I read a lot each week, each day on where the virus is going. I look back at an article for Harvard Business Review, not sure if you read that or not, but from August, talking about, they had laid out the 3 scenarios: worst case, best case, middle case. We blew the best case out of the water already. I mean, if you remember back in March and April, the discussions of how many million were going to die, yeah, not so much. But we've blown those best cases out of the water. Things are going well. Smart data, we're seeing the volumes coming back. We anticipate those volumes continuing. You're seeing the growth here, not just in the return of volumes, but new business we have. So those trends are going to continue as that volume that was suspended comes back online and people begin going back for those mental health appointments and dentistry and chiro and physical therapy, etc. So you're going to hear it first from Pat. Pat says things will get back to normal mid-year. Roll with the changes. Enjoy the time with your families. I realize some of you have suffered loss, and I'm sorry for that. But trying to find the positive in it. Let's strap in for a better 2021. Thank you for working with us. We look forward to working with you in 2020 and 2021 and the oncoming years. Take care. Thank you.